stuff that you don't want is just getting button.
Yes,
But we
I
have
know.
to.
It's about 1 minute past the 10 o'clock hour. Your one family, one radio, Super 92.7. And yes, every Tuesday, we always have guests from Ilera.
Yes.
Lashma. Yes.
And we're excited about the guest in the studio. She's fine.
Yeah, she's fine.
Nice. She's
fine.
sweet. She walked in and had this lovely energy with her. Her aura is beautiful. We have the corporate liaison manager, Lashma, Miss Foluke Yalaju.
Hi, Foluke.
Good morning.
Good morning.
morning.
How are you doing today?
Fine, thank you.
Hope it wasn't difficult getting here.
No, it wasn't.
Fantastic. Great to have you on the show today. And our focus of discussion, aside from us propagating Ilera as wellness of Lagosians, we're going to be talking majorly on the mandatory health insurance and CIN.
Oh,
Yes.
right. But we normally like to start from the beginning. Tell us a little about Lashma and Ilera
Ilera
in particular. Let's start from there.
Okay. The social health.
Okay.
Okay. Good morning, everyone. Okay, so Lashma is the agency charged with the responsibility of managing the social health insurance in Lagos State.
Okay.
So all residents are mandated to enroll on the scheme.
Okay.
So Lashma is the one charged with that responsibility.
Okay. So Lashma has been working on this Ilera, and we found out, we're asking you, it was one of you that told us that Ilera is wellness of Eko. Health and wellness, basically. That's what this is for Lagos. I want to talk about the mandatory health insurance scheme you mentioned in Lagos State. Tell us about that and what exactly it's supposed to do for us Lagosians.
Okay, as I mentioned earlier, the mandatory health insurance is the social health insurance in Lagos State.
Okay.
It was enacted by law in 2015, and the law also it was enacted by law in 2015, and the law further established the LSHS, which is the Lagos State Health Scheme, and it made it mandatory for all residents of Lagos State to be enrolled on the scheme. The law further established Lashma, as I mentioned earlier. Lashma is the Lagos State Health Management Agency, and we are charged with the responsibility of ensuring the administration and viability of the LSHS, which is the Lagos State Health Scheme. The objective of the LSHS is to protect families from huge medical bills and to also reduce out-of-pocket payments, because it's a social health insurance.
Okay.
And it helps to reduce huge medical bills, helps protect families from paying huge on medical bills and reduce out-of-pocket payments, and also to help residents have access to quality and affordable health care in Lagos State.
Okay. What's the full meaning of CIN? Because little people will want to ask.
Okay, CIN is the corporate identification number. The corporate identification number is it's a number that all corporate organization, as the name implies, all corporate organization in Lagos State are to come to Lashma to obtain that number, the corporate identification number. It's a prerequisite for obtaining the social health insurance in Lagos State.
Okay.
Yes.
So what you're saying is that as a company, as a corporation, I'm supposed to get the CIN. That way is going to help me to now be able to be registered on my people, under my staff to be registered under Lashma's Ilera
Yes,
scheme.
please. Yes, please. It's a prerequisite for obtaining the social health insurance.
And it's compulsory?
And it's compulsory. Yes, it's compulsory.
Okay. What was the executive order that was signed by the governor about health insurance for all residents in Lagos? Because I know that, it's something that he has been propagating since 2015, like you earlier mentioned. But what is the executive order that was signed by the governor?
Okay, so the executive order was signed by the governor to domesticate the NHI Act in Lagos State. So as I mentioned earlier, the mandatory nature of the scheme, in May 2015, the law states that it is mandatory for all residents of Lagos State to be enrolled on on health insurance. The law didn't state the form of insurance all residents should procure to obtain. Yes, the law didn't state the form of insurance the all residents of Lagos to pick, but the NHI Act was released by the executive order was released by the governor to domesticate the NHI Act in Lagos State. Because the NHI Act in 2022 was passed into law by the former president Muhammadu Buhari.
Okay.
Yes, in 2022. And in 2022, the law also states that all residents of Nigeria the law states that all residents of Nigeria should have health insurance.
Okay.
And also the law also states that every state should ensure that they have a state social health, a state agency that would manage the social health insurance of each state.
Okay.
So yes, for that of Lagos State is Ilera, which is LASHMA. So that was what the state, the act stated in 2022. That's on the federal level. So
the governor
decided
has
to
now
make it domesticated.
Yes.
Every resident in Lagos be a part of it.
Yes, please.
How is LASHMA ensuring that people are actually able to comply with the executive order?
Okay, so LASHMA has been doing a lot. We have been collaborating with MDAs, that is the ministries, departments, and agencies. Okay, so in the executive order mainly, I'm just going to read a few highlights of the executive order.
Do.
The executive order states that all residents, employers, and workers in Lagos State should comply with the LSHS law of 2015 and the NHI Act of 2022, which makes health insurance compulsory.
Okay.
Also, all MDAs must request for proof of social health insurance before providing service to any resident in Lagos State.
Okay.
Yes. So all MDAs must request for proof of that from any resident. If you go to any MDA, any ministry, any agency, they would ask you for proof of the social health insurance.
It's just like social security number that
Yes.
they ask from the United States. But go on.
Yes. Also, yes, so that will be requested for by the MDAs. And also, when you go to the hospital, the hospitals right now, so we have a lot of hospitals that are
under the scheme.
Yes, they are under the scheme, and they are also registering. They are also registering residents. Once you come into the hospital, you must also show proof of Ilera only in the case of an emergency. That is what was stated in the executive order. So you must show proof that you have the social health insurance before the hospitals can attend to you. Yes.
Okay. So
I wanted to ask if Ilera is ensuring that even people at the grassroots are going to comply to all of this. And I mean, I also want to ask two questions in one. At the grassroots, is there something being done by Ilera to ensure that everyone, even at the grassroots, are going to comply with the health insurance? And I mean, with companies, if my company has a corporate number, identification number, do I need as an individual to have a number as well?
Okay, so for the grassroots, we have been doing a lot. We have been doing systems, going around the
communities
basically. Yes, the communities to sensitize the residents on the social health insurance, the mandatory nature of the scheme, and also to let them see the benefits. It is not just, and we are not just preaching the mandatory nature. We're also showing them the benefits. It is affordable, and when they come on the scheme, they would also have quality health care. It is quite affordable. It is 15,000 naira for a whole policy.
I want to come back to the affordability of it so that we can talk about the scheme and the different plans that you have for the different people. But then that question about if I am under a company and my company has the CIN and my company has put me under the scheme, if I go to a hospital myself, do I still need my own personal identification for Ilera before I can be attended to?
Okay, as I mentioned earlier, I said it's a prerequisite. So once you obtain the corporate identification number, it is mandatory for you to also pick up the scheme, like for you to pay for your staff.
Okay.
For your staff.
So as a staff, if I walked into a hospital, all I need to do is just mention my company's CIN or name or what?
No, please. I mentioned earlier, I said CIN is a prerequisite for obtaining Ilera
Okay.
The scheme, yes.
Okay.
So once you have that, you would also buy
the individual or
plans.
family.
You buy for individual and
Okay.
the plan. You also buy the plan for individuals or family in your company.
Okay, is there any monies attached to you obtaining your CIN?
Yes, please.
Okay, could you tell us about that?
Okay,
quickly?
so for a company between 1 to 10 staff, they have to pay 5,000 naira.
Okay.
So yes. So 11 to 50, you have to pay 10,000 naira to obtain
for
the
the corporate identification
number
to obtain the scheme.
That's not for the plan.
That's not for the plan.
Very
Yes.
clear.
That's
Okay.
not
So
for the plan.
1 to 10 number of people in that company, 5,000 naira for the CIN.
Yes, please.
Okay, keep going.
Okay, so 11 to 50, 10,000 naira.
Okay.
51 to 200, you have to pay 25,000 naira. 200 to 1,000, 50K. And 1,000 and above, you have to pay 100,000 naira. And it is one off.
It's a one-off payment.
You have to renew every year.
It's a one-off
Never,
payment.
ever.
You just get the scheme once and that's it.
No, you just
get
pay
the
for
identification number.
For the
corporate identification
Yes.
number.
Okay.
But once you buy the plan, you have to renew every year.
Okay, now that makes
CIN
sense.
is one off.
Okay.
Oh, okay.
Okay.
That's really good.
I want to come back to, again, the plans that you have on Ilera Eco, just so that whether you are a business, for a business, you need to get the CIN, right? Okay. Let me ask about how to get the CIN first, and then we'll come back to the plans, the broken down plans.
Okay, so for just visit for the corporate organizations, please visit portal.lashmaregulations.com.ng. portal.lashmaregulations.com.ng.
portal.lashmaregulations.com.ng.
Yes.
Okay.
So once you visit the portal, you will see a step by step. It is user friendly.
Okay.
Once you visit the portal, you see a step by step guide on how to pay for CIN and obtain your certificate.
All right. If you are just tuning in, you're on Super 92.7 FM, your one family, one radio. And we are talking to a corporate liaison manager, Lashma, Miss Foluke Yalaju. We're talking about Ilera Eco, and of course the CIN, a corporate identification number for businesses. If you are a business, in fact, if you have you and one other staff, you're already a full business.
Exactly.
So they're talking about the health scheme that's available to you at very discounted rates for Lagos State. And of course, we're following the order of the executive governor of Lagos State that has basically asked that we comply with it, making sure that every single state, so across the states, we're supposed to have health insurance schemes. This one, Ilera Eco, is for Lagos.
Yes.
And so as a business, you want to register your people, your staff under the Lashma scheme, the Ilera Eco scheme. But for you to do that, you need to get yourself a corporate identification number. Are we on point?
On the
For
right
a
track.
corporate, for a business.
For a business.
Yes, we're focusing on a business or businesses right now. Okay, so you need to get yourself a corporate identification number. If you have more than one staff, you're already viable or eligible for a corporate identification number under Ilera Eco, and then you can put your people under the scheme at discounted rate. Now we're going to talk about the plans that are available both for corporate and for individual. So let's talk about that quickly.
Okay, so we have the standard JARA plan. Okay, so for individuals, you have to pay 15,000 naira for the old policy year. That is 12 months.
And what does that give you?
Okay, you're entitled to a lot of benefits.
Okay.
A lot of benefits. You can do surgeries on the scheme. You can do
Minor surgeries.
Yes.
Yes.
And major surgeries, please. Minor and major. You can do laboratory investigations. You can be admitted on the scheme. Our benefits are enormous.
Okay.
And yes, it was just subsidized by the government. Yes, by Lagos State government. So the benefits are enormous.
All right, you can join in on the conversation. If you have any question whatsoever for the corporate liaison manager of Lashma in the person of Miss Foluke Yalaju, call the number 0705 69 00927. 0705 6900927 is the number to call, and send us a WhatsApp message on that same number as well.
You can also send us a text message on 0903 714 2798. That's 0903 714 2798. We have a call coming in. Hello, good morning.
Yes, good morning. I'm on to Super FM.
Yes, you are on to Super FM. What's your name?
Well, my name is Sean.
Hi, Sean. Where are you calling us from?
I'm calling from Festac.
Okay. Thank you for calling, Sean. Will you have a question for our guest in the studio?
Yes. I do have a question.
Okay.
And I really want to commend the work of Lashma. No matter the pain the person is in, the hospital will not attend to you until they get this covered. And it can take sometimes 1 hour, 2 hours. But with Lashma, it's quite different.
Wow.
So I have to tell you that one.
Okay.
Now, secondly, I want to find out for corporate.
Yes.
Please. I have like 14 staff members.
Mm-hmm.
Now I understand that I can buy the insurance for all of them. Does it include their family members or just my staff members alone? Number one. Mm-hmm. Then number two, can they pick any hospital that is closer to their
vicinity?
Mm-hmm. Yeah, instead of them picking all of us picking one hospital.
Okay.
They can all pick the individual private hospital or government hospital that is close to them. That's my number two. Then number three is more like something I would like to point out. You know, recently there was a case of somebody who, we all felt pity for her, who lost the wife during pregnancy. I wanted to deliver because she didn't have 500,000. You know, as much as I want to say, oh, sorry, and I feel for them, again, this information is out. You could have just, because I know Lashma also covers delivery.
Yes, it does.
Mm-hmm.
It does.
And if you know that you have 9 months to plan, all you need to do is to register for Lashma for you and your family. It covers antenatal, I believe so. It covers antenatal and delivery. So most times information is what we need. Not necessarily that, when the government is bad. So I would beg Lashma to please do jingles in people's local dialect. Yoruba teaching, get to the grassroots. People don't even know that this kind of a thing exists. For just under 50,000 naira, we've lost lives in the hospital before. I've seen a man cry because of 50,000 naira. Joe, help me, my son's about to die. And people have to now start donating. Whereas this information, if it was there, they will know what to do. So I think Lashman needs to do more to sensitize people because I think it's a very good scheme.
That's why we're here. That's why they came here as well. Thank you, Shehu.
But the grassroots, speak pidgin, speak Yoruba, speak Hausa, go to that. You understand me?
Yes.
That is how they can understand.
Thank you.
Thank you so much for that.
So I want to mention something very important for the benefit of information. The story regarding the man and his pregnant wife and whether or not the hospital asked them to pay, it's a questionable story. There are many sides of that story. But the point that Chenwe is making is that he is a beneficiary of the experience and of Ilera as a person, and him and his family, and he's talking about his the question about the corporate opportunity. We'll come back to that in a bit. Good morning.
Last Ilera staff.
Okay.
It's not. They no longer give you. They won't give you anything reasonable. Once they go there, you just look for drugs that cost less than they give you, and that's all. The highest they ever do is to conduct tests of fever. That's all.
Have you okay, go ahead.
I've complained to the Badagry
division.
Yes.
Okay.
And they told me that the one I attended last, I think that was 2 months ago. They told me that the drug they have to give me that my HMO doesn't cover it.
Okay.
And I have to go and get it. And that drug is very scarce. See, now I couldn't get the drug.
Okay. So you can confirm that the drug is scarce.
What are those services that the HMO really covers? There was a time I asked them, I want to do a whole test, general body test. They told me it's not covered.
Okay.
And that is possible if I want to do it for my personal purpose.
Mr. Biodun, I would like for you to send us a WhatsApp message so that we can take your name and your number and communicate it to our Ilera Eco people here so that they can take up the matter and look into it squarely. Because, if you say you have reported and something hasn't been done about it, we would like for you to send us a message on WhatsApp right now so that we can have that information and pass it across to them. They're here in the studio, so this is a great opportunity. Yes?
All right.
All right. Thank you very much, sir.
All right. The WhatsApp number would be 0705 6900927. 0705 6900927. Now back to our first caller's questions. Let's take this call first.
Hello, good morning.
BBB at the Gifted Tourist.
Hi, Archangel.
We could tell it was you.
I would love the representative of Ilera Eco to explain vividly, clearly, and concisely what is the plan for the less privileged in Lagos.
Okay.
What does Lashma have for those who either cannot afford or who are suffering one form of disability or another, or who are displaced, just like those we see on the street?
Okay.
Thank you.
All right. Thank you so much, Archangel, for that.
So
Let's
two
treat
questions that we can answer back to back.
Yes.
Sheung, first of all.
So he says for their families, the families of those, if he gets his CIN, that is the corporate identification number, as somebody who has a company, what's the possibility of Lashma adding their families to it? Do they add their families to it?
As a staff.
Okay.
Yes.
Okay, there's a family plan. Family of 4.
Okay.
55,000 naira for the whole policy year. And also we have family of 6. That's 80,000 naira for the whole policy year. When I say policy year, that's 12 months.
Okay.
So for individual, it's 15,000 naira per year.
Okay.
Family of 4, 55,000. Family of 6, 80,000 naira.
So that's individual families, right? So if I am working for a company, now I'm talking about the company owner opening put together a plan for their staff. Say that we are both staff of Tunde's company, right? Does the plan that Tunde give us as staff, does it avail us opportunity to help
add
our
family members
as well
to
it?
Yes, please. It will just subscribe into the family plan.
So it depends on the plan that Tunde chooses for his staff.
Exactly.
Individually or collectively.
So if he has a single staff that is not yet married, he would go for the single plan.
If he has 10 staff
that are not yet married, he will go for the individual plan, 15,000 naira for each. And if he has a staff that
is married,
he
has to do the plan for
the family.
Yes, he will go for the family plan. The family of 4 is 55,000. Family of 6, the father, mother, and 4 children, 80,000 naira.
So that we don't mix this thing up. So now, for someone who has a business, it's important that you get your corporate identification number to be added to the scheme.
Yes, it's
that
a
is
prerequisite.
Lashma. That's a prerequisite. Yes. Now, for every individual in your organization, every staff member, they have to also come under a plan. That 5,000 naira, the number is just
for registration.
It's just for registration.
Yes,
they have to come under a plan.
Company.
Yes. And if anyone who has a family amongst your staff members, they can.
You've just explained that if I have Johnson and Johnson company or Johnson and Bigot company, right? As a business owner, I come and register with Ilera Eco. I get the CIN, which is the corporate identification number, and then I create plans for my staff. So if I single staff, I do plans for them that covers them as singles. Yes?
Yes, please.
Okay, I hope that answers Sheung's question.
Okay, and he was also asking the hospitals, should it be close to their houses, or should all of them, can the hospitals be close to their houses, or do all of them just have to, register under one hospital?
Or hospital that's close to the office?
Okay, so we have a lot of hospitals.
Okay.
So I would advise they pick the hospital close to their house.
Yes.
Okay. Or that which is close to their office.
As the case may be.
Yes, as the case may be. But we do not, right now, we do not roam.
What does that mean?
Okay, so when I mean roam is that, for instance, if you have chosen one hospital in, let's say, Lekki, and you live in Lekki, you you are to use that hospital in Lekki.
And not another hospital,
hospital when you go to the mainland. Okay. Only in the case of an emergency.
Okay. So that case of emergency, very important. So let's say, God forbid, the person lives in Lekki and then they are in Surulere and there's an emergency. What then happens?
Okay, so the person can walk into any Ilera hospital, any hospital registered under Ilera, and
present their information.
And
that will give them because it is an emergency. So please note, they say Ilera doesn't roam.
Yes.
If you choose a hospital, that's the hospital you should use at any point in time. And you want to choose a hospital that's close to your home in case of emergency. However, should there be an emergency if you are far from your home? Emergency.
It has to be
serious emergency. Then you go to a hospital that is close there and present your
LSHS
information
number.
Okay, the LSHS number.
Yes,
okay, Archangel's question. Well, what is the plan for the less privileged? What does Ilera have in store for them? Those that are displaced.
Okay, so there's an equity fund. Is the Consolidated Revenue Fund, 1% of the Consolidated Revenue Fund. It is used to cater for the vulnerables in the states.
Okay.
So we have an arm in Lashma. They are the ones in charge of going around, identifying vulnerables.
Okay.
They profile vulnerables, and if they are identified as a vulnerable, they'll bring them onto the scheme and free of charge. They won't pay for a whole year.
Okay.
So that fund is used to cater for the vulnerables in the states.
Okay,
so
there's something for everyone in Lagos.
Yes. But what you must know is that the health insurance has become mandatory in Lagos. So please go and do the needful for your family and for you. And also, Abiodun, you haven't sent us the message. They will soon go because I want to give them the message as you are sending it. So send your number, a WhatsApp message, or you can send us a text message very quickly on
0705 6900927 is the WhatsApp line, or you can send a text to 0903 714 2790. So finally, where can anyone who's listening get more information about Ilera and Lashma? What are the details? Yes.
Okay, so would advise the residents to just go to our website, which is ilera@lashma.com. Yeah. Once you get there, you would see all the
information.
I'm sorry. It is lashma.com.
Lashma.com.
Yes, lashma.com. Go to lashma.com. You will see the benefits. You will see the premiums attached to it. You will see
everything you're looking for. Basically.
Everything you're looking for, basically. Okay. Yes.
All right. So
and numbers to call.
Yeah, you see lashma.com. It's LASHMA.com. LASHMA.com. When you go there, you see the Ilera scheme, and then if you open it, you see all the information that you need regarding Ilera and getting your own health insurance. We've been talking to
Miss Foluke Yalaju, who is the corporate liaison officer or manager at Lashma. Thank you so much for joining us in the studio. Whatever details that we have, we definitely will send to your table. And I hope everyone in Lagos is listening and they understand that health is wealth. Stick around for more. We'll be right back for Tech Spaces on the Super Breakfast Show.
Get ready for a show that's all about you as Super FM presents Family Matters. Join us every day at 10 a.m. to 10:30 a.m. as we dive into the heart of what truly matters. Your family. Whether you are a parent, a sibling, or a grandparent, Family Matters is your go-to source for insightful discussions, expert advice, and heartwarming stories that will leave you inspired and informed. Family Matters, the ultimate guide to navigating the beautiful journey of family life.
92.7 Super FM.